our 1205 group assignment presentation. For vulnerable populations, we are doing the homeless population. Homelessness is defined by an individual's accommodation situation. To fall into the category of homelessness, a person will be without conventional accommodation and may be sleeping rough, squatting or living in a car, in emergency accommodation or in a youth refuge. People who are at risk of being homeless may be facing eviction, living in accommodation without a lease, below standard or overcrowded. These people live without access to personal amenities, security, privacy and autonomy. There are three types of homelessness: primary homelessness, secondary homelessness, and tertiary homelessness. Here we have a few statistics for the number of homeless individuals in Australia. Australia-wide, there are 105,237 homeless individuals. We can also see that there are more males than females living without proper accommodation. We can also see that Aboriginal Australians and Torres Strait Islander Australians and those who are born overseas make up over half of the homeless population. In the 2006 census, there were around 90,000 homeless people. In the 2011 census, numbers increased by 17% to 105,000 homeless individuals. There are many people who think that homeless people are parasites, bludgers, and a public nuisance, and that they choose to be homeless. This negative slander affects society's views on the importance of helping the homeless. As a group, we chose to research and learn more about this vulnerable group of people because homelessness is such a concerning issue for so many people. We have no doubt all been exposed to the homeless population as we walk through our city streets, and what we see is barely a fraction of the issues at hand. They ask for such necessities that we all have, such as water, food, clothing, and a roof over our heads. These supplies are so basic but so crucial to their personal well-being as it impacts every aspect of their lives. As a group, we also know that practically everyone can help to support the homeless community in a variety of ways, depending on what our circumstances allow, through charity, volunteer work, and other programs.
Homeless people are exposed to a great amount of health issues and risks, which can be classified as environmental, mental, and physical issues. Some people of the homeless community have the ability to live in shelters that are protected for some of the environmental risks and issues that other people who live outdoors are exposed to. Natural disasters such as earthquakes, floods, hurricanes, and fires, as well as changes in the weather, with heat leading to hypothermia and great drop in temperature leading to hypothermia, can have a fatal impact to the homeless community. Also, many homeless people are spotted to be sitting on pavements right next to streets and roads, which exposes them to traffic accidents. People who are of the homeless community often experience some mental challenges. Losing their jobs and houses is a reason that those people feel excluded from their families and friends and society. Low self-esteem is common when those people feel alone, unworthy, and physically dirty. Environmental, social, and financial instability are the cause of depression, anxiety, and stress to those affected by homelessness. When the mentality of homeless people is challenged, some become addicted to harmful, illegal, and extremely unhealthy substances. They see it as a way to escape from the reality they live in. Sadly, those addictions disadvantage the mental and physical health of those addicted. Due to all the previous discussed reasons, homeless people are in great risk of health issues. However, they are also at risk of malnutrition due to unhealthy eating habits. Also, finding water that is good to drink can also be hard. Finding showers and even toilets is even harder, turning people of the community to adopt very unhygienic habits to keep themselves clean. Unhygienic habits and limited accessibility to hygiene products may lead to dental diseases, which afterwards may lead to development of cardiovascular disease. Infections from bacteria spread, fatigue due to not enough nutrients, and insomnia are also very dangerous to the health of homeless people. A very important, very tough time for women who are members of the homeless community is their menstruation period. It is a time when the access to menstrual products, toilets, and showers is the most important yet the hardest to find. Women, in order to be clean, have to come up with ideas on how to stay clean on a very low budget, and no access to toilet, which is often a risk factor for infections. Moreover, another health issue that many homeless people are exposed to is unprotected sex. Sexually transmitted diseases are a common health issue in the homeless community.
The improvements and interventions the government, community and other stakeholders are taking to improve the health of homeless people. One Voice is a non-for-profit organisation helping homeless people all across Australia. In Melbourne, they have created a Melbourne mobile shower bus and laundry van. This mobile service provides homeless people a safe place to have a hot shower, shave, brush their teeth and maintain their dignity. This service is self-contained, which allows it to visit many sites across Melbourne, including Coburg, Cheltenham, Geelong and the CBD. On the first Saturday of every month, they run a Love Out Loud Saturday to give homeless people access to haircuts and trims, clothes, pet care and a barbecue and food. One Voice is helping homeless people to maintain personal hygiene, which is a huge issue among the homeless community. The Australian Red Cross, in an average year, helps 2,180 people to find housing, supports 1,360 people at risk of becoming homeless, and provides 43,400 meals to people experiencing hardship. The Australian Red Cross support people to maintain housing and avoid homelessness through programs including homestay, intensive tenancy support, private tenancy support, and assistance with care and housing for the aged. They support people already experiencing homelessness with programs including Street to Home, Personal Helpers and Mentor Program, Homeless Accommodation Support Service, Housing Support Mental Health Service, and Youth Homelessness and Reintegration Service. They help people exposed to homelessness build life skills and community connections and friendship. They provide education and training support and teach first aid skills with the program Streetwise First Aid. These skills and connections are important to keep people out of homelessness. They also provide regular and reliable meals for people on low incomes or experiencing housing problems. The Salvation Army runs Salvo stores for people to donate their clothing, and those proceeds go to those in need, and they also provide them with the clothing. They have professional screening and recruitment services to help homeless people find a job and get training. They have Adult Services, which is a network of 17 programs that provide support and assistance to homeless and disadvantaged people in Melbourne. These services include residential, community outreach, drug and alcohol, intensive support, disability employment, community and residential aged care.
There are a few ways we can do to help improve the health of homeless people. First of all, we need to explore and understand factors associated with healthcare utilization by homeless people from a national perspective, which include age, sex, race, ethnicity, medical illness, mental health problems, substance abuse, etc. In this way, we can understand why people are homeless and what support they have received in order to provide help that meets individual needs. It is essential to provide homeless people with affordable housing so that they can have a shelter instead of sleeping on the street and experiencing environmental disasters. In addition, community networks should provide homeless people with free food and clean water. An example would be Soup Patrol, run by Australian Red Cross, where people volunteer to provide homeless people with free warm soup and bread, along with some biscuits and fruits at different locations around town. It is very important to provide homeless people with more employment opportunities so that they can make their own money. In addition, some local community activities can establish the community engagement and the attachment to the society and community among homeless people. To improve the health of homeless people, medical aid and coverage should be expanded as it is essential for homeless people to have access to affordable health care. This improvement of accessibility can lead to continuity of care and management of health conditions among homeless people. Besides, the probability of regular nursing clinic or office for primary care should be promoted to maximum the utilization of preventive care interventions. At the same time, it can improve self-reported health as well as reducing non-urgent emergency department use. By donating hygiene products such as clean clothes, body soap, shampoo, hair wash can promote hygiene among homeless people and improve their health conditions. Furthermore, having education about sexual assault, harm reduction and trauma-informed care principles can benefit homeless people by informing them with available public service. Lastly, having public policy to advocate for homeless people, providing support from physiological, psychological, mental, and spiritual aspects are very important in improving the health.
That concludes our presentation on homelessness.
Thank you for watching.